Hello everyone, Namaste.
Hello friends, Namaskar. Week number 10, Expressive Art Therapy, and congratulations. This is the 10th week, 2 more weeks to go. So have patience, more and more patience. What is expressive art therapy?
Expressive art therapy is a therapeutic approach that uses the process of making art to improve a person's physical, mental, and emotional well being.
It encompasses various artistic disciplines, including finger painting, drawing, sculpture, music, dance, theater, writing, and other creative processes as medium for self-expression. All these things what we spoke about, it's a medium for self-expression. What are our ideas about it? Inspiration, whenever you do something good, some good art, it inspires you. And it's a means of communication also, because after all, a painter or an artist is expressing his or her emotions, thought process into the art form, and that is how she or he conveys what she thinks about that particular subject.
So, by communication, you try to find out what art patient knows and what he is interested in, and you can promote that art for improving his quality of life and overall well being.
Caution, can you give something? What is this caution?
That said, expressive art therapy isn't right for everyone. For example, it might not be a good fit for people who are skeptical or unwilling to participate in creative experience. Or I will say, even if they are very physically very much weak, they cannot express, like drawing or writing or something. And if we keep on pushing them that you express, do this art, whatever you are knowing, then they may be unnecessarily put into the emotional and physical stress.
It may also not be appropriate for individuals with certain psychiatric conditions such as
Schizophrenia.
schizophrenia. In this week, we'll have about 5 lectures. In first lecture, we'll talk about expressive art therapy in general, and then thereafter we'll deal with only 4 art therapy. There are a number of art therapies, expressive art therapies, but here in this week we'll deal with only 4: art therapy by itself, then color therapy, centre therapy, and lastly writing therapy.
And faculty for this week is Professor Madhurima Pradhan. She is former head Department of Psychology at University of Lucknow. What is expressive art therapy? This form of therapy is grounded in the belief that expression can foster healing and mental well-being in an adult. It allows individuals to explore their feelings, reconcile emotional conflicts, foster self awareness, manage behavior and addictions, and develop social skills, relax, reduce anxiety, and increase self esteem.
Lecture number 2, art therapy. Again, it will be taken by Professor Madhurima Pradhan. History of art therapy. The creator of art therapy is Margaret Numberg, but she was unable to give it a scientific platform as she did not put it as research material. She was a practicing psychologist in America and artist who had a fascination with the art form.
Finally, it was carried out forward by Kathy Malchido, founder of the American Institute of Art Therapy. And this is a licensing body globally. This is the only art institution that has the privilege to give a doctorate to many universities and has been contributing to the field of art therapy for more than 20 years. She has also developed lots of psycho-competency tools with respect to today's challenges.
What is art therapy? The use of artistic methods to treat psychological disorders and enhance mental health is known as art therapy. Art therapy is a technique rooted in the idea that creative expression can foster healing and mental well being. Doctors noted that individuals living with mental illness often express themselves in drawing other artworks, which led many to explore the use of art as a healing strategy. Since then, art has become an important part of the therapeutic field and is used in some assessment and treatment techniques. Dr. Geeta Joshi, I think there was a patient at the end of life in your hospice and he used to draw.
Yes.
Yeah, what?
Yes, very rightly you remember. We had one patient in hospice. He was suffering from head and neck cancer of a very advanced stage. And within few days after admission, we came to know that he is a painter and he was running painting classes. So we brought all painting material, canvas and all paints and everything for him. And every day he started working on the canvas. And this helped us a lot that he required minimum medication for pain management. He remained happy, healthy and cheerful till he died. And he came out with number of paintings which we have displayed in our hospice.
They have been put in very good frames, and in the whole hospice, there are about 10, 15 of his paintings that have been put on the walls. Color therapy, again being taken by Dr. Madhurima Pradhan.
While color psychology is the study of how different colors can influence human behavior and perception, color therapy is different. Color therapy is based upon the unproven assumption that certain colors can impact people's energy and impact health outcomes.
At some point, we have all experienced the way in which color can affect us. For some people, seeing the green nature on the daily run is an instant mood booster, or they instantly feel a little better wearing a favorite yellow dress. Like we are here at IIT Kanpur, a beautiful campus and lots of vegetation
Greenery.
and greenery, good roads, clean roads. And we made it a point to go out every day morning, 6 o'clock we are out, and for about an hour or so, we just roam around on the roads, looking at the greenery all around. The practice of color therapy can be traced to Indian Ayurvedic medicine, which claims that application of certain colors can correct imbalances in our body's chakra system.
Scent play therapy, a healing journey, again given out by Professor Madhurima Pradhan.
Bene-
Benefits. Research shows that scent tray therapy reduces the symptoms of many mental health issues and increases resilience. Clients free themselves of deep seated negative emotions during scent play therapy because they can express their inner thoughts while feeling accepted by the therapist. In addition, scent tray therapy
can help therapists dwell into the meanings that clients develop and assign to their experiences by monitoring their engagement with the toys or symbols they choose to play with. Scent therapy is typically a pleasurable sensory group or family therapy. It can help increase emotional expression. We experience that it facilitates the natural expression of emotions as part of individuals, reducing the psychological distress of discussing traumatic events or experiences.
Another therapy, complementary therapy, is writing therapy. Writing therapy or expressive writing is a form of expressive therapy in which clients are encouraged to write about their thoughts and feelings, particularly those related to traumatic events or pressing concerns, to reap benefits such as reduced stress and improved physical health.
Writing therapy may be used in many environments, including in person or online. It may be supervised by a mental health professional or even occur with little or no direct influence from a counselor. That means one can do writing therapy by oneself.
Many cancer patients write their blog and they write their own experience about facing a particular cancer, and this will be useful to other patients who are reading going through that blog.
This is the Graham Greene, a very famous Canadian actor. What he's writing about writing therapy. Writing is a form of therapy. Sometimes I wonder how all those who do not write, compose, or paint can manage to escape the madness, melancholia, the panic, and fear which is inherent in a human situation. Therefore, he says that writing, everybody must write. Whatever feelings come to you, you must write it down. In fact, when I was a child, my parents always used to tell me, "Ki write a diary."
Yes.
I used to write a diary.
Yeah, we were
So,
encouraged to do that.
yeah, so in primary school, I used to write a diary, and then thereafter, when I came to high school, somehow there was not enough time, so I stopped writing it.
Yes.
In fact, most of the leaders, like Mahatma Gandhi, he also used to write, but his personal secretary, Mahadev Desai, and from those writings, we can generally come to know all the time during our freedom struggle. That is from 1915 to 1947 when we got independence.
So, this is in short, you are going to learn about various therapies which will be useful to you and your patients, or maybe family and friends. Thank you very much.
Thanks, dear friends.